Hi everybody, our lecture today is about tablets, lozenges and lollipops. This lecture is based on the reference from the book of Ensels of Pharmaceutical Dosage Forms and Drug Delivery System, 11th edition, chapter 8. After this lecture, you should be able to describe drug absorption, distribution, metabolism, and excretion for oral administration of solid dosage forms. List possible routes of administrations for tablets. List categories of excipients with examples which are employed in making tablets. Differentiate between various types of tablet dosage forms. Compare advantages and disadvantages of various types of tablet dosage forms. Describe processing problems possibly occurring when making tablets. State USB compatible requirements for tablets. Describe storage conditions for tablets and give examples. And last but not least, describe properties of lozenges and lollipops. To facilitate your study, this is the lecture outline, so you can have a big picture of the lecture. First, in the lecture, you will learn how a drug can go to the target tissue and description of oral absorption. Then you will learn about introduction about tablets. Then the next topic is about tablet excipients. Under tablet excipients, you have different excipients such as diluents, disintegrants, lubricants, glidants, wetting agent, and others excipients such as sorbent, binders, adhesive, colors, dyes, etc. About types of tablets, if based on the drug dosage forms, you will have sugar or chocolate-coated tablets, film-coated tablets, gelatin-coated tablets, delay action and enteric-coated tablets, repeat action tablets, effervescent tablets, chewable tablets, buccal and sublingual tablets, and molded tablets or tablet tetrage. In making tablets, there is possible processing problems. They can be capping, lamination, picking, sticking, or mottling. Then you will learn about tablet evaluation and control, storage of tablets, and then the last topic is about property of lozenges and lollipops. In general, solid dosage forms can include powders, granules and capsules, tablets, lollipops, lozenges, and suppositories. Sometimes suppository can be categorized as semi-solid. The video from this link will help you to answer the question how a drug can go to the target tissue from oral administration. In general, a drug, in order to be absorbed, has to undergo many processes. First, the solid drug will be disintegrated into small particles. The small particle will be dissolved into the solution, and this step we call dissolution. The solution then will be absorbed into the cell membrane, and the process here belongs to the permeability of the structure of the drug. So a drug, after being dissolved and absorbed, and then it can go through the liver under some kinds of metabolism and absorbed to the circulation system through the portal vein. The presence of the drug in the blood is used to calculate the bioavailability of the drug. Now we go to the introduction of tablets. Tablets are the most commonly used solid dosage forms, usually prepared with the aid of suitable pharmaceutical excipients. Mostly the tablets are used for oral administration. Other routes can be used for tablets including sublingual, buccal, and vaginal. In order to make tablets, there's a need of different excipients. In general, we need to have diluents, disintegrants, lubricant or glidants, wetting agent, absorbent, binders or adhesive, colors and dyes, flavoring agents, and sweeteners. The first of four tablets here are the most major tablets that need to be almost like for every tablet. In making tablets, they need to have a machine we call tablet machine. This is one of example of tablet machine. The powder will be put into the funnel and flow through the system, and then will be compressed to make tablets. Machine can make like thousands of tablets per day. This is the section of the compressor in the machine, and this is a punch and dice belong to the machine. The shape or sizes of tablets depends on the punch and dice. Now we go to more detail of the exhibit using tablets. The first or the most important one is a diluent or filler. This one helps to provide enough volume and also provide cohesion to the powder, which is beneficial in the transfer of the powder blend into tablets or capsule shell. You can see here if you mix the diluent or filler with the API, because there's a cohesion between them, so the drug can be and the drug and the excipient or diluent can be combined easily, and that's helpful to be compressed into tablets. The most commonly used diluent is lactose. Lactose is cheap and easy to make tablets. In case the patient is tolerant to lactose, other excipient or diluents can be replaced by microcrystalline cellulose, sodium carboxymethylcellulose (CMC), or starch. As we know that any dosage forms or tablets must be broken down into small pieces or disintegrated before it can be dissolved and absorbed. Disintegrants excipient assist the breakup and distribution of a tablet or capsule content in the stomach. Generally, it can take 15 to 30 minutes for the drug to be disintegrated. Examples of excipient used as disintegrants are starch, cross-carbamylose, sodium starch glycolate. Starch is very common use. You know that from the previous diluent or filler, starch can be used. So starch can have two functions as a diluent and also can be a disintegrant. You know that to make a tablet, the powder in the tablets need to flow to different sections of the machine and then being compressed. So the flow properties of powder is very important to ensure the consistency of the process. Lubricant or glidant are excipients usually being added to the tablets powders to enhance the flow properties of the powders. Examples of lubricant or glidant are fumed silicon dioxide, magnesium stearate, or calcium stearate, or stearic acid, or talc. Magnesium stearate is very commonly used as lubricants. Only less than 1% it can provide very good flow properties of powders. However, these ingredients make the tablets more hydrophobic and it can reduce the dissolution rate. So in order to solve the problem, another excipient usually added to the tablets powders, they are wetting agents. Wetting agent is a capsule surfactant. It helps to enhance the drug dissolution, especially when magnesium stearate is used as a lubricant. This is the structure of one wetting agent molecule. It includes the hydrophilic head, and the yellow here is the hydrophobic tail. So when the surfactant is mixed with the mixture, and then the drug will be disintegrated, and then it will release small particle. When the surfactant here is in the disintegrated process, it contact with the body fluid, and the body fluid mainly as water. It will all the surfactant or wetting agents here will be oriented in the way that the hydrophilic head will face contact with the water, and lipophilic or hydrophobic tail will be oriented in the center, and it will capture on the hydrophobic ingredient, like for example magnesium stearate or some hydrophobic drug, and this have to increase the dissolution of the tablet ingredient. Example of wetting agent used for the tablets making is sodium lauryl sulfate. Besides the main of 4 ingredients or excipients as mentioned above, diluent, disintegrant, a lubricant, and a wetting agent, we also sometimes need other excipients such as adsorbents, binder or adhesives, colors and dyes, flavoring agents, sweeteners, etc. This is the summary of common excipients used for tablets or capsules. Tablets and capsules share a lot of common properties in using tablets. Gel, diluent, filler, disintegrant, lubricant, coloring, wetting agent, etc. After we learn about the excipients used for tablets, now we learn the types of tablets. The types of tablets are categorized based on different factors. If it's based on dosage form properties, in general, we have 10 types of tablets. Compressed tablets, standard or multiple compression, sugar or chocolate coated tablets, film coated tablets, gelatin coated tablets, delay action and enteric coated tablets, repeat action tablets, effervescent tablets, chewable tablets, buccal and sublingual tablets, and molded tablets or tablet surgeries. If it's based on the types of administration, you can have tablets for oral ingestion. That means this kind of tablet is for swallow intact. And except a chewable tablet, and it's not swallow intact. Or tablet used in the oral cavity, these kinds of tablets are allowed to dissolve in the mouth. Or based on the type of administration, you can have tablets used to prepare solution before administer, for example, effervescent tablets or vaginal tablets or other tablets like molded tablets, tablet surgery. Now we go to the most common category of tablets that is based on the dosage form. The first simple tablets is standard compressed tablets. These tablets are formed by direct compression without special coating. The tablets are mixed from powder, granules. It can be alone or with excipients. Example: uncoated aspirin, uncoated acetaminophen, or uncoated ibuprofen. This is some example of shape and size of tablet. And again, the shape and size of tablets is determined by the punches and dies. Sometimes the tablet on the surface tablet, you see that you see some feature like this we call score tablets. These tablets can be split based on the score on the surface of the tablets. Multiple compressed tablets is special kinds of compressed tablets. In this kind of tablets, there are multiple APIs, and the APIs can be like incompatible, or when mixed together, it can have some physical or chemical reaction or degradation. So in this case, the tablets will be compressed in multiple layers, so the APIs or the incompatible ingredients will not contact to each other. Another purpose for multiple compressed tablets, in case like the tablets is used to produce repeat action or prolonged action. So in this case, each layer of tablets will provide different release. Examples of multiple compressed tablets are layered tablets. This is a kind of repeated compression to produce the multiple layers. For example, a mixture of phenylephrine, hydrochloride, and ascorbic acid with paracetamol. So this one, if you mix together, that can have kind of a physical and chemical incompatibility. So in general, for these kind of tablets, paracetamol and phenylephrine hydrochloride will be compressed with some excipient in one layer. Paracetamol and ascorbic acid will be compressed in another layer. And finally, the layers will be compressed again together. So there will be no contact or direct contact between ascorbic acid and phenylephrine hydrochloride. Another example of multiple compressed tablets or inlay tablets. Example is metformin. The metformin is a case of inlay tablets. It contains 500 mg sustained release for the outer coat of the drug. And then in the core of tablets is compressed another ingredient, that's bioglitazone, 15 mg. Multiple compressed tablets are also occur when tablets is within tablet. That means for this kind of tablets, tablets in general, some compressed tablets will be compressed and form the tablets first, and then another tablets larger, it will be included outside of the tablets, and when two of them compressed together, you have some layer tablets and some inner tablet. To make this kind of tablets, there's need some special tablet machine, and the compact core, the inner tablets here, look like this, and the compact or outer tablets have the compact shell. That means the machine can have two separate tablets and then have them stick together. Example of this kinds of multiple compressed tablets are multivitamins or antibacterials. This is an example of a multiple compression coated tablets or tablet within tablets. Inside of this tablets, it can be iron layer or vitamin layer, and the inner of tablets, it can be some kinds of calcium coating. The next type of tablets are coated tablets with sugar or chocolate. This kind of tablets usually used to mask the bitter taste of the drug. So some sugar or chocolate can be coated on the surface to improve the acceptance of the patient. Example of sugar-coated tablets is a neocordion sugar-coated tablets. Usually, the tablets, compressed tablets will be prepared, and then the compressed tablets will be coated with additional water-soluble sugar or chocolate layer. And again, this water-soluble sugar or chocolate works as a barrier to mask the taste and odor of the drug inside. Disadvantage of this kind of tablets is it's more complicated process than simple compressed tablets, and the layer of sugar or chocolate usually thick. It can increase the weight of tablets, and it can increase about 50%, make the tablets larger and heavier than the original compressed tablets. Also, in the process, they need to have some process like seal coating or subcoating and syrup coating and polishing. So the process is more complex than the simple compressed tablets. However, these kind of tablets are more rare today because they can have some other technology to mask the taste of tablets, but do not make the tablets like heavier or larger. For this kind of tablets, the storage condition is to avoid any humidity or wet hand to contact, because the humidity or wet hand to contact can dissolve the chocolate or sugar on the surface. Film coated tablets. So the problems of disadvantages from sugar coated tablets, because these kinds of coated tablets can prevent the penetration of humidity to the compressed tablets inside. Also, it can also mask the taste of the ingredient inside. Example of film coated tablets are ibuprofen, lamivudine, or film coated tablets. For these kinds of tablets, there's a thin layer of film will be covered or coated on the surface of the compressed tablets. The film can be made from PEG, polyethylene glycol, or some kinds of plasticizer, surfactants, and others. The film here made from polymer. Usually the polymer is hydrophobic, so that's why surfactant is included to increase the drug dissolution. Advantages of these kinds of coated tablets as compared with sugar-coated tablets is more durable, less bulky, because only 2 to 3% increase in weight or size of the original tablets, less time consuming to apply, and increase the formulation efficiency and resistance to chipping. With the growth of technology, another kind of tablets can be made is a gelatin-coated tablets. Gelatin-coated tablets, the process is of making tablets similar to film-coated tablets, but the surface to coat is not a thin film. The surface is gelatin. The surface of compressed tablets is gelatin. This means first the tablet is made by simple compression, and then gelatin layer will be coated on the surface of the tablets. We have gelatin coated tablets. Usually the shape of the gelatin coated tablets is have prolonged a shape look like the capsule. And with this kind of coated tablets, this one also doesn't increase much in weight to compare with the original one. It facilitates the swallowing and it have more tamper evident than unsealed capsule. To compare with the other tablets, it's easy for swallow, and to compare with a capsule, it provide more tamper evident than unsealed capsule. And also with these kinds of tablets, it can make like large amount of powder to compare with capsule. Another advanced technology to make tablets is to make delay action and enteric coated tablets. Example, aspirin enteric coated tablets. As we know that aspirin can be used as an anti-fever drug, it can reduce the pain and inflammation. However, aspirin can be degraded in the stomach, or it can cause the stomach ache because it's reduced the pH in the stomach. So using aspirin as for oral administration it can create a lot of side effects for the stomach. The enteric coated tablets have to solve that problem. This kind of compressed coated tablets is coated by an agent that cannot be destroyed by the stomach. The tablets will release the drug in the intestinal media instead of the stomach, or instead of the gastric fluids. The agent to make enteric coated tablets are fats, fatty acids, or wax, etc. This kind of tablets help to prevent the destruction of the drug by gastric juices and reduce the irritation of the stomach by the drug. And also, this kind of drug will release the drug more in the intestine, so it promotes absorption of the drug in the intestine. Remember, for the simple compressed aspirin, patient usually is advised to take the aspirin with the full stomach, so it can reduce the side effects of stomach ache. However, the enteric coated tablets is advised to take with the empty stomach or fasting rather than full stomach. Usually this kind of enteric coated tablets, because it designed not to be degraded in the low pH, so when it takes with the empty stomach, when the pH is low, the drug can pass by the stomach easily and go to intestine, and the enteric coating will be degraded in the intestine and then release the drug for absorption. If the patient take enteric coated aspirin after meal, what happened? After meal, the pH increase, and when the pH increase, it may degrade the enteric coating in the stomach, and that will be a problem for the patient. Another advanced technology to make tablets is to make repeat action tablets. For these kinds of tablets, these are layer or compression coated tablets. These kinds of tablets usually contain 2 single doses of medication. one dose for immediate release and the other for delayed release. This kind of repeat action tablets has two layers. The outer layers or the shell will be rapidly disintegrate in the stomach, and then the drug can be released there to have some action or absorption. Inner layer or inner tablets, this kind of layer will be insoluble in gastric media but soluble in intestinal media. So this layer will release the drug in the intestine. So with this kind of tablets, it can help the drug release and absorb both in the stomach and in the intestine. That we call repeat action. This means it has some action in the stomach and have repeat action in the intestine. Another type of tablets is effervescent tablet. Effervescent tablets is not used directly for oral, but it had to be put into a cup of water for dissolution before administration. So the drug will be dissolved in water, and the liquid in here the patient will take orally of the liquid from the cup. In the composition of this cup tablets always contain API and a mixture of sodium bicarbonate, citric acid, and tartaric acid. This mixture can work as a disintegrator or disintegrant, and also it produces effervescence. When you put the drug into the water, what happens? The water creates an environment for this reaction. Sodium bicarbonate will react with acid in the composition to form the salt, release water and carbon dioxide. The carbon dioxide in the water will create the carbonate solution, and this carbonated solution will mask the taste of the drug. Chewable tablets is a special kind of tablets. Even though this one is used for oral administration, but the way of use is different. The patient will not swallow whole intact of the tablets, but rather the tablets will be chewed by the teeth into small pieces before being swallowed whole. Example of chewable tablets are vitamins, antacids, antibiotics, etc. In the chewable tablets, it always contains mild effervescent drug complex, special flavor such as mannitol and gum base. This composition will facilitate the chewing process, and also the chewing activity acts like a disintegrant activity. That's why for this kind of tablets, you don't need any disintegrants, because the chewing activity, the teeth can break the drug into small pieces. So for chewable tablets, you don't need disintegrants. This very helpful when it provides pleasant tasting tablets useful for children or people who cannot swallow whole tablets. And usually these kind of tablets to make is more specific and require different machine, and usually more expensive than the whole swallow tablets. Remember, for chewed tablets, the patient need to be consulted not to swallow the whole tablets. The tablets need to be chewed carefully before being swallowed. Other kinds of tablets are buccal and sublingual tablets. This kind of tablet is not for oral swallow whole. It's rather be inserted or put or placed under some body cavity. For buccal tablet, we have some very common products, for example, progesterone, prochlorperazine, or sublingual tablets. One of the common products is nitroglycerin. These kind of tablets are absorbed through the oral mucosa after dissolved slowly in the mouth. It can be in cheek pouch for the buccal or under the tongue for sublingual. These kind of tablets will provide rapid drug effects. The drug can be dissolved slowly, but the solution can be absorbed immediately into the blood system. It's useful for the drugs that are destroyed by the gastric acids or poorly absorbed from the intestine tract. This means it's useful for first pass effect because this kind of drug can go directly to the blood without going through the liver, so it can avoid any metabolism of the drug. This kind of drug also contains no disintegrant. Disintegrant is not necessary because this tablet is dissolved slowly. You don't need to have any disintegration or chewing. The tablet just will be placed under the tongue or in the cheek pouch, and the tablet will be dissolved slowly and release the drug. Another kind of tablets are vaginal tablets. This one is not for oral administration. It's for the insert into the vagina for local effects. The shape of this kind of tablets can be oval shape and directly put into the vaginal place, or it can be in the uncoated poodle shape and it will be delivered to the body cavity by some device. The tablet usually is made by simple compression. Molded tablets or tablet trays are common in compounding pharmacy. The previous mentioned tablets are usually made from the manufacturer, not from the compounding pharmacy. Compounding pharmacy make molded tablets or tablet trays more. These kind of tablets usually contain very small amount of API and it in a small size. Example, atropine sulfate 0.4 mg. This kind has a shape and size very small, about 65 mg, usually in a cylinder shape, molded or compressed tablets. Very soluble in water. It can release the drug rapidly when used sublingual or buccally. This guy is similar to a sublingual or buccal tablets, but it's made more from the molding, compressing, assembly compressing, assembly molding. This kind of tablet is less hard than the buccal or sublingual tablets made by the manufacturer. Mostly this kind of drug used to compound potent drugs or nitroglycerin. It has rapid disintegrating or dissolving dosage forms. Excipients used for molded tablet or tablet trays are diluents, moistening agent, and mannitol. Diluent can be sucrose and lactose. Moistening agent are usually alcohol and water. Alcohol is used very small percentage. Mannitol, this one for sublingual or chewable tablets. Mannitol to provide a pleasant taste when the tablet is placed under the tongue or in the cheek pouch. Some kinds, the molded tablets or tertiary tablets can be made by different mold. It can be hard rubber or metal. And usually the upper plate will be dies for tablets and the lower plate for a punch of tablets. These kind of tablets can be compressed using hand. Alright, this is a summary, a table for the tablets with different types of tablets and the property or example based on the drug dosage forms. In making tablets, there are several possible problems occurring during the process of tablets making. They can be capping, lamination, picking, sticking, or mottling. Capping happens when partial or complete separation of the top or bottom of the crown from the main body of the tablet. This is kinds of capping. Lamination is the separation of tablets into two or more distinct layers. This kind of lamination. Capping only happens with partial or complete separation from the top, but lamination can create several layers. Capping and lamination are usually caused by entrapment of air during processing. This means during the compression of tablets, if there's some air entrapped in the middle of the tablets, capping or lamination can happen. And with the transportation and storage, the layer or the part can be broken down and separate from the tablets and make this kind of tablet broken. Picking Picking is the removal of the surface material of tablets by a punch. Usually, it happens in the local portion of the tablet's face, and the tablet face are missing some part. Usually, it happens when the lubricant is not used enough to lubricate the punch. Sticking is the adhesion of the tablet's material to the die wall of the machine, so it's lost the polished face on the punch. Modeling usually happens during the storage process when air or humidity can be drawn or moisture can be drawn into the surface of the tablet. Some reaction can happen and it makes unequal color distribution. In order to evaluate and control the quality of tablets, a USP has a different test on the tablets. First is general appearance. For the general appearance, tablets need to have visual identity and overall appearance, size, shape, color, odor, taste, surface, etc. Everything must be consistent and appropriate with the expected description. The next test is the hardness and resistance to friability. This testing is to test the durability of tablets during the transit or during the transportation. These are kinds of machines to do the hardness or friability testing. When tablets are compressed as made, the sample we put into the fibrillator here, and this will be rotate to certain speed, and at certain time, only some percentage of erosion is allowed. Because if this testing is not met, the tablets can be broken easily, and it cannot be used for the patient. The next important test is disintegration testing. This one is to show how quickly the tablet breaks down into small particles. This is a disintegration tester used for the tablet's control or evaluation. There's a chamber. The tablets will be put into this chamber, and this one they call a basket, and the basket will be immersed into a chamber full with the fluid. The fluid usually to imitate gastric fluid condition, and the basket will go up and down into the fluid, and then with the time disintegration will be observed and recorded, and usually the disintegration must be completed within 30 minutes. Dissolution testing. This one is to measure the extent and rate of solution formation from a dosage form. This is a dissolution tester. This machine has many chambers. The drug will be put into the chamber here, and in the chamber there's a paddle to rotate, and the liquid for the solution tester usually if the drug like for absorption in the intestine, the drug the fluid in the chamber here is to imitate the condition of the intestine fluid, and with the time there's in the USP there's some requirement or standard requirement for a certain percentage of drug must be dissolved. Tablets are recommended to be stored in dry, cool place. Tablets can be packed into containers made from plastic or from glass. There's some special API has some unique property that can influence the drug quality during the storage condition. There are nitroglycerin and finasteride. Nitroglycerin, this one a powder can be volatile, and when it's volatile in the appropriate condition, the drug can mitigate within the bottles from one tablet to another tablet and create inconsistent amount of APIs among tablets. In order to fix the problem, it's recommended to store any nitroglycerin in dark colors such as brown, airtight, and glass container. Keep the container tied closely away from heat and moisture. And usually nitroglycerin is recommended to put in original bottle. Finasteride, this one ingredient can be absorbed through the skin and cause the birth defects in male babies. So women who are pregnant or may become pregnant would not handle crushed or broken tablets of finasteride. If there's any contact with this medicine occur, immediately wash the affected area with soap and water. And again, for these kinds of tablets, it's recommended to be stored in the original container. So we just learned some common dosage forms of tablets. Now we go to lozenges and lollipops. There are also solid dosage forms. Lozenges. This is some picture examples of lozenges. Lozenges, sometimes called Tokis. Example: benzocaine, dextromethorphan, etc. Or cough drug, or to treat the cough and cold symptom with minor sore throat. These kind of lozenges can be used for topical or systemic effects. It can be absorbed either buccally or sublingually and dissolved slowly in the mouth. In order to make a lozenge, there's several methods. With the compression or molding, it can be made from compression or molding method. Compression, lozenge need to have the tablet machine, and the punch and dice will be different from normal tablets because it's large and flat. They have large and flat punch to make lozenge. And usually to compress this kind of tablets, it has a high degree of compression. To compress this very tightly lozenges. Another method to make a lozenge is molding. This method has been applied more commonly in compounding pharmacy. To make lozenge with molding method, it's just like making candy, sugar candy. So first, the API will mix with the base by heating, or we call fusion method. The base will be melted and then incorporate with the API. And then the mixture of base and API will be poured into the mold. And usually the base has a flavor syrup, so this helps to increase acceptance from patient. There are two types of lozenges: hard lozenges and soft lozenges. The hard lozenge is similar to hard candy. The base used to make a hard lozenges are sucrose and can be combined with other sugar or carbohydrates. So the successful preparation depends on the handling of the syrup and monitoring of the temperature. It's very important to monitor the temperature to ensure that the base can harden at the specific time. Usually melting temperature is from 149 to 154 degrees Celsius. And this lozenge is made by melt the base sucrose or other sugar or carbohydrate, melt the base, and then the drug API will be mixed with the melting base, and then the whole mixture will be poured into the mold and then will be hardened with time. Soft lozenge. The base different from hard lozenge. Soft lozenges base are flavor fatty base, for example chocolate or polyethylene glycol (PEG) base or sugar acacia base. This kind of soft lozenge, the method is similar. The base will be melted with the heat, and then the API will be mixed into the base and then poured into the mold. It's different in the state of soft to compare with the hot one from the previous one. Not a special solid dosage form, sometimes we call tablets, but it's a kind of lollipops. It's just like candy lollipop. How to make it just similar to the way you make candy lollipop. Example of medicated lollipops are fentanyl active. It helps to produce the pain quickly in cancer. To make this one, you need to use a base sugar-based lozenges, just like the same way you make lozenges, a harsh one. And how to make it? The base will be melted with the temperature, and then the API, the fentanyl, will be mixed into the mixture, and the mixture will pour into the lollipop mold, and then it takes time to harden and cool down, and you have medicated a lollipop of fentanyl. This cap lollipop, the patient will take just like the way they take a lollipop candy. The drug will be slowly dissolved into the mouth but quickly absorbed through the blood system. And the effect is the release very short, within minutes, and the effect lasts within very short time too, just around 15 minutes. Okay, so we just learned about tablet dosage forms, and besides we learned about lozenges and lollipops for medication. In summary, the drug in a tablet after orally administered will pass the GI tract, liver, and enter the blood circulation from the portal vein. From there, the drug can be distributed to the target tissues and finally excreted out of the body. Tablets are commonly used for oral administration besides sublingual, buccal, or vaginal administration. Tablets contain main excipients such as diluent, filler, or filler, disintegrants, lubricants or glidants, wetting agents, and some other excipients such as adsorbents, binder, adhesive, colors, dyes, flavoring agents, sweeteners, etc. Tablets can be in different forms, such as coated tablets, delay action, repeat action, effervescent, chewable, buccal, sublingual, molded tablet, tertiary, etc. Different types of tablets have different advantages and disadvantages. Possible process problems occurring when making tablets are capping, lamination, picking, sticking, and mottling. Tablets need to be stored in a dry, cool place. Special care for storage or dispensing can be for certain products that contain volatile ingredients or products that can penetrate through the skin. Lozenges are a type of tablets that can be used for topical systemic effects. There are two types, hard and soft lozenges. Each type contains different excipients and base. Medicated lollipop is a type of sugar candy containing sugar-based lozenges, and API for immediate release. That's all for today's lecture. Thank you for your attention. If you have any question, please email me or come to my office during the office hours.